2020 taught us gratitude, highlighted our bravery, and demonstrated our humility. Throughout the COVID-19 pandemic, HOPICS has consistently provided services to our community while also uplifting our employees.
Through advocacy for appropriate funding, program redesign, and heroic employees, we were able to innovate miracles.
We were able to support the most vulnerable people with high risk for COVID-19 through providing 100 safe beds through Project Room Key, administering 909 COVID tests for the community, providing 113,328 meals to address food insecurity, engaging 122 new landlords for our housing programs, triaging and screening over 12,000 individuals for our programs, and providing permanent housing to 1,117 households.
Redefinimos el papel del trabajador esencial.
We redefine
the role of an essential employee.
We committed to the well-being of our employees by providing consistent Wellness Wednesdays where staff were able to focus on their wellness. We created a safe space for processing through meditation and resiliency circles. We continued our staff appreciation virtually. We had more frequent check-ins with employees by supervisors. We provided free lunch to staff.
Provided lodging options for staff that was exposed to COVID-19. Made on-site COVID-19 testing available. Adjusted employee schedule to respond to childcare and other COVID-19 related obstacles. Adapted attendance and leave policy to accommodate anxiety and life challenges due to COVID. Implemented premium pay for our brave staff that had in-person interaction with clients and
we
hired
106 employees from the community. We maintained employment. We employed disaster services workers at PRK and program offices that needed work. We accepted interagency transfers from other SSG divisions that did not have work. We employed Chrysalis and Goodwill employees. We changed our organizational structure. We ideated and created a new model for permanent supportive housing that was focused on the Leimert Park area, where we housed 91 street-to-home clients in 90 days. Street to Home is a collaborative partnership between our rapid rehousing team, our housing department, our behavioral health substance use disorder programs, and our outreach teams to coordinate quickly to move people into permanent supportive housing. The model uses a variety of funding resources to quickly move people from the street into housing. It challenges the system status quo by creatively repurposing existing funding to create sustainable and supportive permanent housing models. It also adapted the way we worked with landlords to provide a more holistic approach to community solutions.
Throughout the pandemic, we have continued to uplift new programs. We have implemented programs such as rental assistance programs, rent relief programs, Silver Villa, which is a housing program for seniors, Safe Landing programs, which just provide services for families who are experiencing homelessness, 2 Project Home Key sites, Travel Plaza, which hosts families, EC Motel, which is iconic because we actually own the motel, which provides housing for single adults. We've opened up 2 safe parking programs, Safe Parking Compton, Safe Parking Central, which really gets those individuals who are actually sleeping on the streets in our neighborhoods a safe place to stay. Another iconic services we just opened up was our Navigation Center, which provides a resource for individuals who are homeless to be able to shower, have storage, and laundry facilities, and also provide case management assistance to actually get them off the street.
We addressed the daily needs of our clients and meeting them exactly where they were at through street-based food delivery to both our housed and unhoused clients, helpline and distribution centers, holiday meals and food giveaways, and the World Central Kitchen donated meals.
We adapted. We adapted and created skill sets to keep people safe. We implemented safety screenings at all sites. We adapted our staff lounge to honor the 6 feet social distancing. We worked with the DSWs to keep everybody safe.
We set the standard for messaging on how to communicate in a crisis through creation of safety protocols. We remained consistent. Increased communication to keep staff informed, motivated, and encouraged. Increased daily cleaning at program and interim housing sites. We implemented Zoom and virtual meetings, adapting to a remote recruitment process. We had deep cleanings immediately following reported cases or exposures. COVID-19 medical doctor provided direct guidance and ongoing case consultation.
We held virtual Ask the Doctor Q&As for employees whenever we felt it was needed. Management was trained to be contact tracers.
We became a testing site for LA County testing at our Crenshaw area location. We facilitated testing for incoming interim housing clients.
We coordinated with DPH and DHS to ensure that all interim housing sites were safe to mitigate any outbreaks.
We
We
advocated
advocated for our rights and created a safe space for employees to express their feelings and anxieties around social injustices. On June 24th, we hosted a Walk for Justice, where over 100 HOPICS employees and community partners marched in solidarity to stand for justice against racial disparities in Black and brown communities.
On September 1st, we hosted This Is Personal, where we discussed the Black experience of essential workers.
we address the harsh realities that our communities are facing through support groups and meditative spaces.
We provided access to voter information and registration tools by hosting voting polls for the November elections.
We walked in our vision.
Walked in our vision.
We walked in our vision.
Fought homelessness one day at a time.
Luchamos por los desamparados un día a la vez. Familia de HOPICS.
HOPICS family,
HOPICS family, we see you.
We appreciate you.
We did it.
We did it.
We are amazing.
can't stop.
Can't stop.
Can't stop.
No podemos parar.
Won't stop.